This video is for general information only and is not a substitute for medical advice. Always speak to your GP, diabetes team, or pharmacist about your individual circumstances and never change your doses yourself. Are you taking Rybelsus for type 2 diabetes and wondering whether it might also affect your weight? It's one of the most common questions we hear, and it's worth understanding what the clinical evidence actually says. So let's start with the most important point. Rybelsus, which contains semaglutide, is licensed in the UK by the MHRA specifically for managing type 2 diabetes. It is not licensed for weight loss. If you've seen it discussed online as a weight loss treatment, that's not what it's approved for here in the UK. That distinction really matters. That said, many people taking Rybelsus for diabetes do experience some weight reduction as a secondary effect, and understanding why that happens helps set realistic expectations. Rybelsus works by mimicking a hormone called GLP-1, which your gut naturally releases after eating. It helps your body produce more insulin when blood sugar rises, reduces the amount of glucose your liver releases, slows down how quickly food leaves your stomach, and acts on appetite centers in the brain. The result for many people is feeling fuller for longer and experiencing fewer cravings, and that's where the weight effect tends to come from. In terms of timing, any weight changes are gradual. Some modest changes may begin within the first few weeks, but meaningful results build slowly over several months as the dose is adjusted by your prescriber. Clinical trial data from the Pioneer program showed that weight loss is dose-dependent, meaning higher tablet strengths within the licensed range tend to produce greater effects than lower ones. This happens over a period of 6 to 12 months, not weeks. It's also worth knowing that individual results vary quite a bit. How your body responds depends on a range of factors, and lifestyle, including diet and physical activity, plays a significant role alongside the medication. If you're taking Rybelsus and curious about what to expect for your own situation, that's a really good conversation to have with your doctor or diabetes care team. They can look at your full picture, your blood sugar control, kidney function, and any other medications you're on, and give you guidance tailored to you. If you're also taking insulin or a sulfonylurea, it's especially important to flag this with your team, as there's an increased risk of low blood sugar. Do not adjust your doses yourself. Any changes should always come from your prescriber. One more thing worth mentioning, if weight management is a primary goal for you, your doctor may discuss Wegovy, which is a different formulation of semaglutide that is specifically licensed in the UK for weight management under NICE guidance. That's a separate conversation to have with a healthcare professional. On the safety side, the most common side effects of Rybelsus are gastrointestinal, things like nausea, vomiting, or diarrhea, often more noticeable when starting treatment or when the dose is increased. There is also a rare but serious risk of pancreatitis. If you experience severe or persistent abdominal pain, please contact a doctor promptly, and always take Rybelsus exactly as directed by your prescriber and the patient information leaflet. Your pharmacist can advise if you're ever unsure. So, to recap, Rybelsus is licensed in the UK for type 2 diabetes, not weight loss, though some gradual weight reduction can occur as a secondary effect. Any changes build slowly over months, not weeks. Lifestyle modification alongside the medication remains important, and always speak to your GP, diabetes team, or pharmacist about what's right for your individual circumstances. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, please do like this video and subscribe to the Bolt Pharmacy channel for more evidence-based health information.